everybody. This is Dr. John Hayes. Welcome back to Beating Neuropathy and Chronic Pain on 95.9 WATD. I have once again with me Laura Amaral. Laura is a certified holistic health coach. And Laura, before the break, we were talking about, the hidden dangers of sugar, processed foods. We spoke about, of course, the big idea that too much processed food, sugar in particular, leads to metabolic resistance, metabolic syndrome, a big part of which is inflammation. Inflammation causes chronic pain, aggravates neuropathy, and just about every other condition known to mankind. So that's why we're here. But we want to make sure, before I let you go tonight, that we have really given our listeners something to work with in terms of, a philosophy of losing weight and maintaining weight. I had a guest on the phone last week, and we spoke about drastic measures, something really totally different than what we're talking about today. Not that it doesn't have a place, but what you do is so appealing because it does connect to the real heart of why we struggle. So let's talk about that.
Right, yeah. And going back to what I said earlier, that I just want your listeners to know that sometimes people say to me, Laura, I feel like I look at food and I gain weight, or, I don't eat that much and I gain weight. And I just want your listeners to know, when I said earlier that it's not always about willpower. Yes, heightened awareness is half the battle. Yes, you're accountable, but it's time to really open up your lens, which you and I can help people that are wanting and willing and able. We can help open up their lens, if you will, and it's just, I just want to make the point and drive it home that it's not just so easy to just go out and lose weight. It's just not. It's just not. And that, people don't want to be unwell. People don't want to be overweight, generally speaking. And I just want your listeners to know that if you're experiencing some of these symptomatologies, that we are created differently. Not everyone burns off calories and has super efficient metabolic rates. And certainly not everyone has those same neurotransmitters in their brains that we were talking about earlier, indicating that they're sated, that they're satisfied. So we now know that those obese individuals, they lack the neurotransmitter dopamine, which I talked about earlier, which means that they do require more sugar to hit that portion of the brain. It's the same portion that we know heroin and cocaine and alcohol hits. So, it's really about shutting that off and helping them get off sugar. You can't just have a little bit. You get sent off onto that roller coaster, if you will, where you have a little bit of sugar and it just sets you up wanting more and more and more. And unfortunately, that just exacerbates the metabolic resistance syndrome that you and I are so greatly concerned about for our nation. And what was the original question?
Well, we want to talk about. No, you're doing great. I mean, this is also important. But your philosophy, if you will, how you express, getting over all this with patients, how you work with patients and helping them, get back to an ideal weight, and then of course maintain it.
Yeah, just really, again, I don't think that diets work. I worked in that industry for close to 8 years in my 20s, and I know that it's really about learning how to tap in. What is your intuition telling you? What does your body need? Some days you might need more meat. Some days you might need more chicken or more fish, and just really, again, opening up their lens and helping guide them. The program that I've put together is customized to that individual. I attract a lot of men and women that are perfectly normally weighted, to be frank, that are looking to optimize their health and well-being, that know, hey, we're aging to 100 and beyond, so I've got to optimize my time here. I don't want to feel like crap, in my 70s, 80s, 90s. I want to feel well. We're not supposed to get diabetes, cancer, stroke, and struggle with that and be on pharmaceuticals. We're really not. We're meant to live until an older age, and then hopefully pass in our sleep, literally. So we're not meant to have all these woes. It's what the food industry, and it's what we're ingesting. And so really what I do with that individual is get them what's right for that individual as far as food, and using holistic remedies such as herbs and medicinal teas, and we get into meditation and breathing techniques, and we all have stress in our lives, John, so I'll work with people. We're supposed to have stress,
right,
but learning how to manage stress more effectively, and learning how to establish boundaries, learning how to say no, and really learning how to take better care of oneself, especially those type A personality types, I find, just really, which I used to be one,
Understand completely.
So
yeah.
So really, and also I think helping educate, and really, oftentimes I hear a lot from clients, and even people out at these farmers markets I've been doing, where they just feel like they're emotional eaters. They just keep eating and eating and eating, like especially the evening hits, and they just feel like, hey, Laura, I'm stress eating. What do I do about it? And I think that's another problem as a whole that we as a nation are experiencing, is this emotional or stress eating. And I think, we're subjected to drugs and alcohol and cigarette smoking and food. And so the first sign of pain, we're wanting to push it down. We don't want to experience pain. We don't want to experience discomfort. We want to feel good. But what happens, my theory, is that by pushing these things down, we all have experience. We all have past and painful, traumatic things, and it's really how the individual deals with it and doesn't stuff it down. So the emotional eating thing, what I do with my clients is help them realize it's okay to feel pain. It's okay. That's your body trying to talk to you.
That's right.
Right? And
That's
instead
right.
of pushing it down with food, really, and then, then you're left feeling in the evening like, I feel horrible. I shouldn't have eaten that. So now your inner voice got pushed down with what it's trying to talk to you about and help you resolve on an emotional level. So now you're focused on how crappy your stomach feels because you ate too much. So I help people get off that cycle too. And then the great thing, why I call it Authentically You Wellness, is really when you're authentic with yourself and when you're true to yourself, and that takes a bit of courage, admittedly, but when you are willing to do that, it opens up amazing doors when you can just look and find out what is your higher self, what is your intuition, what is trying to come through to you as far as your life purpose. And when that individual identifies that, John, it is just the most amazing thing for me to see that sort of they just blossom, and then their life is just never the same. It's incredible.
You're so right. I can't thank you enough for taking time out of your busy weekend to be with us.
Absolutely.
Laura. This has been wonderful. I do want to make sure before I let you go that folks listening know how to get in touch with you. So
sure, absolutely. So www.authenticallyyouwellness.com, and it's YOU. And again, I welcome the opportunity for your listeners, if you're so inclined to have a health history consultation with me. You can go right onto the website, read more about metabolic resistance, insulin resistance syndrome. You can pull down a health history form and email it right over, and we can set something up.
Awesome. Laura, thanks so much. You're listening to Beating Neuropathy and Chronic Pain on 95.9 WATD. Be sure to stay tuned for my good friend Dr. Mark Mincola on the Natural Health Show next.